So this is Pityriasis alba. How does it represent? First, we'll talk about the morphology of the lesion. First, there are several. If you can see here, 1, 2, 3, 4, 5. So 5, and here confluent lesions 1, 2, 3, 4, 5, 6, 7, 8 here and there as well, and somewhere around the neck. And these are hypopigmented. Hypopigmented means pigment is less than the normal skin tone. So this is almost white in color, denoting the name alba. It is mildly itchy. Sometimes there is scaling also. So it is actually a hypopigmented patch. It's not raised anywhere. It only scales, and sometimes it is itchy, but otherwise there is no papule, pus, pigmentation, nothing. So it is hypopigmented and usually 1 to 4 centimeters in size. It's actually a low-grade dermatitis occurring in the age range from 3 years to 16 years, and sometimes it is associated with atopic dermatitis, and it is often noticed after sun tanning because of the tan. The reference area, like the whole skin tone, is darker in color, so this hypopigmented zone becomes really prominent because now this is dark. This area has become dark due to suntan, and this is not changed. This has not changed. So that affects the whole representation. The whole thing becomes really prominent. Conclusions. There is a document where it is said that okay, there is a relationship between UV radiation and Pityriasis alba, or there is an association of inadequate or excessive bathing and P alba. Sometimes low levels of serum copper, and sometimes though fungal cultures and KOH are always negative, but Malassezia yeast has been discussed. It disappears over years by itself. So resolution is self-resolution. Without any treatment also it will go. And sites, mostly this. So the cheek area, neck, and sometimes shoulder and forehead. Forehead is also there. But mostly this area has been affected. Now the diagnosis. When you see the hypopigmentation, how will you differentiate between vitiligo and P alba? So if there is hyperpigmentation which does not enhance on wood lamps examination, it is Pityriasis alba. If there is no fluorescence, then also it is Pityriasis alba. But in vitiligo, what happens? Hyperpigmentation is enhanced with bright fluorescence. So bright fluorescence with in that hypopigmented area denotes vitiligo. Otherwise it is PA, which is Pityriasis alba. The KOH or the fungal culture. KOH mount is negative and fungal culture is also negative in PA. Now the treatment part. Because it is a benign and self-limiting disease, so there is no treatment which is required, but definitely symptomatic treatment can be given. If there is redness, scaling, or an itch, then 1% hydrocortisone can be given, or tacrolimus 0.1, which comes under the brand name of Tacrose 0.1 or 0.03%, because it can itch a bit when you apply tacro. That can be given to the patient if the patient is really wants that hyperpigmentation to go away. And in long term, emollients like petroleum jelly, they do wonders, because obviously scaling will be reduced with petroleum jelly, and also skin barrier is also protected. But in extensive cases, we can use narrow band UVB narrow band excimer lamps to help in the hyperpigmentation. However, there are no complications to P alba. So if you want to leave it alone, you can leave it and wait. So it can resolve spontaneously by itself.